Mental health. This is part 2 of mental health discussion. And today's guest, Lynete Etemesi, a lawyer and the founder of Mental Wellness Project Africa. Welcome, Lynete.
Thank you so much. Thank you, Emmanuel, for having me here on this show. I am really grateful. Thank you.
Okay. Now, how bad is it, mental health in Kenya?
Well, it's quite a pandemic, because if we talk about mental health, I would talk about it as an unseen pandemic, because we've been talking about COVID and going on and on about it being a pandemic. But statistically, based on a WHO report, which is the World Health Organization, 1 out of 4 people has a mental health condition in Kenya. And when we narrow it down, 1 out of 5 women tend to have a mental health condition. So it's quite worrying.
Okay, now you seem to be an advocate to it, and you're a lawyer also. Now, what really attributes to this when it comes to Kenya? You mentioned about mental health being at a pandemic. What can you attribute to this?
Well, there are a lot of issues that we have as a country in terms of which we can attribute to mental health. The first thing would be toxic work environments. We tend to work in very fast-paced environment with very toxic bosses, extremely long working hours. The second thing could be issues around gender-based violence, where you have domestic violence, sexual violence, which attribute to gender-based violence. Then we can also have issues around sexual orientation, something people do not talk about, especially when people are transitioning. You have the transgender, the intersex persons who feel like they've been left out within the LGBTQ community. I believe that this is a topic that is really not talked about, but it really affects persons of mental health. Then we also have issues around education, in terms of there's a lot of pressure when it comes to our education system, where you're forced to be, it's very result oriented, where all of us are literally forced to perform and you constantly have to be at the top. So I believe those are some of the few factors that actually contribute or attribute to poor mental health in the country.
Does any of these factors have anything to do with the foundation of Mental Wellness Project Africa?
Yes, it does. And I will just brief you on the history of Mental Wellness Project Africa.
Yes.
Personally, I am a person of lived experience. I have gone through a lot of issues around mental health. I suffer from anxiety and depression. And this was more or less a build-up because I had a personal experience. I was in a toxic relationship. It was very abusive, which ended up... it didn't end up quite well. And then also at the same time, I was working in an extremely toxic environment, which was a law firm, where it was long working hours, poor pay. So all that attributed to me having a mental health condition. But as fate may have it, when I left the firm, which I did not have a plan B, by the way, when I was leaving, I know that's very risky, but I did not have a plan B. When I left, as the odds may have it, I ended up being hired working for an organization called Health Rights Advocacy Forum, where it actually majors issues around mental health advocacy and trying to advocate for favorable policies and legislative framework around mental health. So I worked with them, more or less consultancy work with them. But when I left, I felt like this is what I'm passionate about and this is something that I want to do. And that is what drove me to kind of create Mental Wellness Project Africa, which focuses on creating mental health awareness, ensuring that there are proper mental health policies both at school and in various institutions of work, and also create peer support networks. And also something that I'm working on currently is issues around telecounseling and subsidizing the rates of therapy, because it's very expensive for people to get therapy. So that's what Mental Wellness Project is all about. It's still a new baby, but I'm hoping that it will actually get traction, because mental health is an issue that needs to be addressed.
You mentioned about policies, and you've also you have an experience on it. Now, what are some of these policies that either a government or a non-government organization that have when it comes to fight war against the mental?
Well, I'll start. For starters, we have, I think we have to give credit where it's due, where we have issues around the Constitution. So we have the Constitution under Article 43, which states that every citizen has the right to the highest attainable level of healthcare.
Mhm.
So that is what is supposed to inform all the health policies that we have. But unfortunately, we have the Mental Health Act number 10 of 1989,
Yes.
which is very retrogressive in terms of issues around mental health, because it was heavily borrowed from the Mental Health Act of 1954, which is English. So if you look at some of the issues that are there in the current Mental Health Act, does not actually portray the progressiveness that we have made in terms of mental health. And it comes about, so some of the issues that it brings out, which are very detrimental to human rights, include involuntary admission, where a patient can be admitted by a doctor against his or her will, and this is something that's been documented.
Yeah.
So moving towards that, we are trying to lobby various organizations to have the Mental Health Amendment Bill with 2020, which was reintroduced recently, which covers issues around human rights of persons with mental health disabilities and all that. We're trying to lobby for it to be passed, because at least it shows, it incorporates the progressiveness of issues around mental health. Then we also have the Mental Health Policy 2015 to 2030.
Yeah.
That particular policy is a very beautiful policy. If
Yes,
you look
I
at
read
it,
the policy. Yeah.
it's a very beautiful policy. It incorporates, it advocates for more mental health funding, more human resources. It also advocates for, inclusion of alternative practitioners, inclusion of vulnerable groups. It's a very beautiful policy, but unfortunately, it's never been implemented.
Mm-hmm.
And that's the issues we're having right now. And I believe as civil society groups, non-governmental associations, and various stakeholders in mental health, we're like, we have this beautiful policy that was drafted in 2015, but this particular policy has never been implemented, which leaves us to the question that why is it that we Kenyans tend to have this whole adrenaline rush of drafting legislation or drafting policy, but then we end up shelving them? Since 2017, we've actually had over 100 pieces of legislation and policies that have been drafted, and they've been shelved in various aspects. So my question is, why do we keep legislating, yet we have something as beautiful as the mental health policy? Why don't we take steps in implementing it?
Why do you think this is the case with the government? Because I understand they also have a task force of mental health. So why do you think this is the case?
You brought me to a very interesting point, the task force.
Yes.
It was a fight for the task force, because I remember the task force is a product of BBI. If you do not know, there's a provision in the BBI report that says that there should be formation of a mental task force that will look into the mental wellness and happiness of Kenyans. So we start with the composition of the task force itself. Purely medical professionals, doctors. My question was, if you're going to have a task force that is looking into the mental wellness or the mental health affairs of Kenyans, why isn't it inclusive? Why does it just have medical professionals? Why don't we have persons from NGOs? We don't even have persons of lived experience in mental health sitting in that particular task force called their caregivers. So already there was a fight from that going onwards.
So are you saying it's a political document? It's a political task
I wouldn't
force?
say I would say it's a product of a political document, because it was stated in the BBI and it went ahead and it was formed, and that's what it was. The report was launched last year in July 2020.
Yes.
I have my reservations about it.
Okay.
Which I believe if I comment about them, maybe people will look at it in a different light. But I feel like what the task force was recommending and where we are at in terms of mental health, we still have a long way to go. Because one of the provisions was establishing a mental happiness commission. My question is, we as Kenyans, we have not even been able to resolve the issue of lack of funding in mental health.
Mm-hmm.
When you're talking about a commission, some of these things are, you're taking us 10 steps ahead, yet we haven't even solved the basic issues that we have around mental health. So I believe I've had my reservations about the report, but if I were given an option, I would have actually gone for, let's implement the policy first before we go to the task force report.
Okay, now you mentioned about the being basics of mental health. Now, what are the basics that have not been addressed the mental health sector?
Funding.
Funding.
That is the first problem that we have. If you look at it in Kenya, we have about 100 psychiatrists. If you look at the ratio, we do not have enough psychiatrists. Two, we do not have mental health.
The whole of Kenya?
Yes, we have
47 million.
We have 100 psychiatrists, so compare the ratio. We only have one hospital, specific hospital, other than Madari Hospital, that specializes on mental health. Then we have, of course, Kenyatta National Hospital, which is a level 6. But if you look at the county level, we really don't have facilities around mental health. We go down to the primary level, the community healthcare. We don't have issues, around mental health. Insurance, NHIF, and we have NHIF that does not provide for mental health. Also, other insurance companies don't provide for mental health. We also have the current UHC, where everybody is singing the universal health coverage. We do not have a benefits package for mental health. So when we talk about the basic things, those are some of the basic things. And funding, mental health, the mental health budget constitutes of 0.5% of the health budget and 0.01% of the actual budget. Madari Hospital gets close to 140 million every year, and which is mostly used on recurrent expenditure. But then you have hospitals like Kenyatta, which get 9 billion a year. So you can compare. Those are some of the basic issues that we need to address. We do not have proper infrastructure. We do not have funding. So those are some of the main issues that we need to address around mental health before we can talk about anything else.
Okay, now shifting gears, you mentioned quite a lot there, especially when it comes to the insurance. Because I was going to ask about the insurance and how best can they come in and chip in when it comes to mental health.
Well, if you look at...
and how affordable will it be also?
Well, recently we had a budget policy draft a budget policy statement that was issued. And it stated that NHIF will be increased to about 6,000 bob per household when it comes to... and that includes mental health services. I believe that's a step in the right direction. We also have... in the Insurance Regulatory Act, they said that insurance companies should actually should cater for every medical service. And that means that a lot of insurance companies, as much as they do not fund for mental health, but they are actually supposed to. So I think it's a push, which should be from the government and various, stakeholders, which will push insurance companies to actually provide for insurance. NHIF, I believe it's quite essential, and I believe that's a step towards the right direction. So I believe because mental health has always been stigmatized and, put aside, I believe the fact that the conversations are starting to come up, then that's when now you start realizing the importance of actually people having insurance, because medication is expensive, therapy is expensive, treatment for psychosis is expensive. So there's importance for people to substitute it with insurance.
Okay. Now, let's shift gears towards the social media. You mentioned about that. And also, I'll connect it to safe spaces. We have enough safe spaces for mental health. And how has social media contributed to mental crisis, especially in our country, Kenya?
I would tend to say that we really do not have enough spaces, because I believe we still are very cultural in our thinking. And if you look at it, it is generation... the millennials and the Generation Z that have really been loud when it comes to speaking around mental health. And I believe our parents were never really conversant with this issue around mental health. So it will take some time to try and destigmatize them around issues on mental health. And that's why I keep pushing to have conversations, because we never... And that's, I believe, this is a conversation for another day. But I believe that's why a lot of us carry a lot of trauma, because we have not been able to have that safe space to offload. Secondly, in terms of social media, you've been seeing the issues around cyberbullying, especially, and I feel like social media is a double-edged sword. It's good for information, but at the same time, it's really affects us in terms of, I'd give an example, Twitter. Somebody goes ahead and gives their opinion, and you find persons like Kenyans on Twitter descending on them and, insulting them and abusing them, which makes people end up leaving social media. And at the same time, it affects them mentally. Even so, the president himself saying that I had to leave Twitter
Twitter.
because of how abusive people get. What I usually get upset about is that people are very judgmental in these spaces, and what people don't understand is social media is an element of people showing the best side of themselves, but yet people have other demons that they battle with outside. So I believe
So where's the missing link?
the missing link, I believe, is more or less, like I said, it's a double-edged sword in terms of that. The missing link is, how do we control the aspect of cyberbullying? How do we enforce the element of cyberbullying? Because if someone is bullied, cyberbullying, it has detrimental effects to their mental health and how they feel about themselves. What action can we take on people who actually, cyberbully? I feel like that is what we need to do. We need to have enforcement mechanisms on people who actually perpetrate cyberbullying.
Okay.
Yeah.
Now, you've been a victim of mental health crisis.
I have been a victim of mental health, and I mentioned I was in a very emotionally abusive relationship.
How did you bounce back?
That's a very interesting question. Right now, I believe when you go through, it was because I hit a new level of a low when I was then. I've always been that child who's been extremely good at what they do performance-wise. Everything for me was in line, but I remember I'd had to deviate at some point because of going through whatever I was going through, and I hit a low. And I remember I wasn't able to open up to my parents because I felt that they would judge me because they were all about being perfectionists. So I felt like they wouldn't judge me. I also felt like I couldn't open up to my friends because at that point in time I didn't have friends. And the problem is, when you're from abusive relationships, your abuser tends to have sidelined you from your friends so that you do not have so that you can actually be more or less, they can manipulate you even further. So by the time I was leaving, I had no friends. My relationships had hit an all-time low. So I remember I had seen a poster somewhere. It was a support group that said, we deal with trauma, it's a support group, and it's free. So join us every Thursday and talk about your issues. So when I went there at first, I thought, oh wow, they're actually these things. The way you go to a place and it's, those alcoholic support groups, and they're like, hi, my name is Lynn.
Yeah.
Hi, Lynn. And that was the whole environment. But the more I kept listening, the more I realized there's so many more people like me who need the help that they need. So I remember after going through this difficult period and I started working in the mental health program, is when I decided one time I sat with my mom and told her, this is what I've been going through, this is what I went through. And she was like, you should have told me earlier, because I've been seeing this mental health conversation and I've been trying to get acquainted with it. So how do I help? I was like, counseling is expensive. At that particular point, I wasn't on my 2 feet. I decided, you know what, I'll start going for counseling. I'll start getting help. Other than counseling, I believe you also need to have your own personal way of dealing with things. So for me, it has always been journaling, meditation, and working out and reading a lot. I'm an avid reader, so reading takes my mind off all these things. I wouldn't say I'm 100% there yet. Healing is a process, but I'd advise people who are going through mental illness or depression or anxiety or any form of mental disorder, get a support group. Those people would really help you.
Do you have any support group that you'd want to recommend?
Well, I've been working, so based on what I do, I've been working with a lot of people who deal with mental health illnesses, but currently I'm working with an organization called the Mental Health Alliance of Kenya. They're all persons who are going through mental health issues, and they have support groups, both virtual and they meet up. So I'd advise for anybody who would want to, maybe they can reach out to my page, Mental Wellness Project Africa on Twitter, and then I can link them up with the support group.
Okay, I'll ask my producer to put the information.
Yeah.
He will put the information there about what you're working on, and also how
people
can reach you out.
Yeah.
Yes. So, what are your last thoughts on mental health crisis in Kenya?
Mental health needs to be taken seriously. There's no health without mental health. Everybody should prioritize mental health. First thing, in schools, your maths teacher is not your guidance and counseling teacher. They should never double up. Schools need to set aside funds to actually have a mental health professional to take care of the needs of their students and their individuals. You cannot use your maths teacher as the guidance and counseling teacher, number one. Number two, offices need to create proper mental health policies. You have sexual harassment policies, you have human resource policies. Why don't you have mental health policies? Start thinking around that direction. Number three, insurance companies should start giving insurance with regard to mental health. It's very important. Number four, the government should think of increasing the funding when it comes to mental health. I think that's all I have to say. And when we're looking at mental health, let's take a multi-sectoral approach. Let's not just look at how to add on to hospitals and forget these other aspects in society. That's all I have to say, and please do take care of your mental health.
Okay. With that, we end the conversation. Lynete Etemesi, thank you so much for coming to the show.
Thank you so much for having me.